Hiya and kia ora. My name is Heidi Waldron, and along with Megan Anakin, we are delighted to warmly welcome you to today's session. As we begin, on behalf of AIPPEN and ANZAPPE, I acknowledge and pay respect to the traditional owners, custodians, and knowledge holders of the lands and waters across Australia on which our members live and work, and to their elders past, present, and future. AIPPEN and ANZAPPE acknowledge Māori as tangata whenua and Te Tiriti o Waitangi partners in Aotearoa, New Zealand. I invite you to introduce yourself and make any acknowledgements you feel are appropriate using the chat function of Zoom. Please ensure your first and last name are visible on your video tile. If two people are joining from one device, please list both names. If you are an AIPPEN member, please add IPE after your name, or if you are an ANZAPPE member, please add ANZ after your name. This will help us to assign a good mix of people to the breakout rooms. This event is being recorded. Please turn off your video if you prefer. However, we encourage you to turn it on during breakout rooms, which will not be recorded. Please feel free to use the chat to share comments and questions throughout today's session. These networking events aim to spark conversations among those interested in IPE, encouraging the exchange of ideas and practices. We invite you to draw on your own experiences to foster meaningful connections and share insights. This is a great chance to connect with colleagues in a discussion-based session introduced by our guest presenters. Today's session is titled Final Year Medical and Nursing Student Interprofessional Patient Advocacy, a Diagnostic Simulation. This session will explore the role of simulation in developing interprofessional skills with a specific focus on role understanding and communication. Let me share a little about our presenters. Niki Lillibridge is an intensive care nurse with research interests in interprofessional communication and collaborative practice in healthcare. Niki works at the University of Melbourne, coordinating the graduate certificate in intensive care nursing and assists in the implementation of interprofessional curriculum across the School of Health Sciences. Morgan Rayner is a general practitioner and medical educator who coordinates the core clinical years at University of Melbourne. He has specific interests in digital health, interprofessional work, student wellbeing, and community engagement. Morgan was recently awarded Associate Fellowship of ANZAPPE. Louisa is the rehabilitation physician at the Royal Melbourne Hospital, and at the University of Melbourne, Louisa is the Deputy Director of Student Education at the RMH Clinical School and final year subject coordinator of the MD in the subjects of clinical scholar and transition to practice. Louisa has a strong interest in preparing students for the transition to clinical practice, including through interprofessional education. We anticipate that you will leave with at least one new idea to explore and widen your network of colleagues with interests in interprofessional education today. Over to you, Niki, Morgan, and Louisa.
Thank you very much. I'd love to start off and thank everyone for their time here today. We will go through and swap between each other some certain parts where I suppose our kind of interests and strengths lie as well. But the first thing I'll go through is why did we undertake this research? And so interprofessional simulation, from what we and part of the scoping review will go into, saw would often occur in the post-graduation, and by that I mean when we've entered the workforce. So from a personal point of view, it'd be really good to hear from everyone in the breakout rooms. I only started doing simulation, both high fidelity or low fidelity, once I was an intern or a junior doctor and above, whereas during medical school, we much more focused on just doing it within our cohort. But as a healthcare practitioner of any type, you really need to be able to collaborate and communicate from day one. So day one on the ward, you might have a met call or some kind of big team event where you're not entirely sure about what everyone's roles are, what their skill sets are. And so we wanted to prepare students ahead of entering the workforce about what to expect. With the literature that we undertook, just a few brief definition. So interprofessional simulation is used to train students to work in interprofessional healthcare teams. And social congruence that we'll talk about can ground simulation in targeting barriers to communication through. So that social congruence is really what's the role understanding between two groups, making sure that there's a psychological safety and learning in that space, that a non-judgmental environment is built and developed, almost like with everyone who's doing a lot of simulation, that basic assumption that everyone's there trying their best and we're all working together. So there's the pilot simulation that Niki's going to talk about in a little bit more detail. We've got an ongoing scoping review with one of our wonderful students. That's ongoing at the moment. We're really close to the end. And so this led to the pilot as we started looking into it, but also I'll just tell you some of the findings that were pulled out of the scoping review so far. The scoping review findings with about almost 5,000 participants. It was often medical students and that were mainly working with nursing students, which we'd love to talk about a bit more later as well. That was the most common dyad or pairing of healthcare student groups. And the most common scenario was the deteriorating patient simulation or the emergency setting, that the MET call was what was being run in almost all those simulations. Group sizes ranged from 2 to 12. So again, that how many students before it gets a bit too busy. Debriefing was core in all studies, and the longer simulation time course, it kind of could go up to 4 weeks. So often it was a lot shorter, kind of 1 or 2 or 3 days. So the gaps in the current literature is that most studies would simulate a small aspect of, and I suppose it's a bit what we were looking for because a lot of us were starting out in medicine, but we were, of course, looking for anyone who was involved alongside as well, is that it often looked at just a very small aspect of the doctor's role. So managing a patient who's just had a cardiac arrest, very much around just that small focus point, or starting antibiotics in a septic patient. There was not many long-term outcome measurements, not a huge amount of studies assessing behavioral change in clinical practice as well. So what the findings that we're working towards are, and what we've sort of pulled so far out of the scoping review, this is a bit of a preview, is that interprofessional simulation can enhance medical student non-technical skills, which is what we'll talk about in the pilot. So specifically, by doing this as students, so a medical student, nursing student, not only are they developing something like, yes, we put the cannula in, we start the fluids, we start to see them developing an understanding of, well, I actually didn't know that the nursing students could do that, or I assumed that the medical student, aka the doctor, would do that. And so going into the workforce, it'd be good to have those gaps addressed in the students before they enter. So embedding longitudinal simulation to consolidate skills. So one-off would be better than nothing, but ideally sets that build on each other across years or across at least a year. And very much specific learning objectives around psychological safety. So everyone's there. You can feel very intimidated, not only within your own cohort, but especially if you feel like someone from outside, nursing, physio, OT, is maybe passing judgment. So working really hard on a safe environment to learn. And so directions for future research, more around validated outcome measures for social congruence. How do we actually check that what's being done is meeting that criteria? Are there behavioral changes once students enter the workforce that see better patient outcomes or better teamwork? Broaden the scope of scenarios. Probably the emergency situation where the patient is crashing and everyone needs to work together. It is very important, but things like a complex discharge summary meeting where we're just struggling to get someone home, we think that that's also an area that practicing and understanding roles during their kind of tertiary education would be very beneficial once entering the workforce. So next slide, and then I'll hand over to Niki to take us through the pilot. Thank you.
Thanks, Morgan. So as Morgan said, I'll take you through a few slides in regards to the pilot that we did, which was just published in Focus on Health Professional Education. And then we'll take you through a few polls before we head into our breakout rooms. So this was a unique multi-institutional program that took place across two universities. Student recruitment was voluntary. It was intended to be a diagnostic simulation, so it was co-created with both nursing and medicine input. It was a deteriorating patient emergency scenario. And we had focus group debriefs that were recorded and professionally transcribed, and we used a thematic analysis model to code keywords and highlight themes, which essentially sort of created a conceptual model, which I'll take you through in just a moment. So the actual pilot itself so the students were orientated to the space, to each other, to their facilitators, and then given essentially a brief handover about the simulated patient. It was approximately a 60-minute scenario. As I said, it was a deteriorating patient scenario where essentially a medical or a pharmaceutical error was built into it. And we recruited final year nursing and medical students for the pilot. And we had focus group and debriefing post the simulation. Thank you. So this is an example of the thematic analysis that highlights the keywords encoding and eventual themes that we generated from the diagnostic sim. I'll show you the quotes a bit more in depth in a few slides, but essentially it appears that social stigma, role uncertainty, and reluctance to advocate really impacted on the students' ability to communicate and to be a cohesive team, which then resulted in patient safety being negatively impacted. Thank you. And adjacent to patient safety being negatively impacted, there were also overarching themes of teamwork and enhanced social congruence. So the students really taking an interest in each other's roles, looking at themselves as individuals, and then placed within the team and how that impacts their team cohesion. And in the next slide, I'll just show you a bit more detailed examples of how we came up with this. So I'll let you read the students' quotes, but here essentially the students identified not only their own deficits, but then applied it as to how this essentially impacted their ability to collaborate and function within the simulated learning environment. Thank you. And then this one really looks at them reflecting, and their comments really suggest that the sim opportunity offered opportunity for relationship building and enhanced social congruence that, we could hope that they can take to their clinical practice. So interestingly, and maybe slightly disturbing, simulation was the first time that these students had actually actively engaged with other disciplines. And their reluctance to advocate really seemed to stem from a lack of social congruence and role uncertainty within the simulated environment. And we noted that the trusting relationship started to form after the simulation and during the debrief, which really highlights that repeated exposures allow students to develop shared norms across professional groups, and that debriefing after these scenarios really makes implicit social dynamics explicit and discussable and something that they can work on together. In conclusion, it really reiterated that interprofessional simulation offers the opportunity to bridge educational silos, that students sometimes don't necessarily recognize the incongruence until it's named, until they can speak about it in a safe environment. and that most existing sort of validated research tools are individually focused and not necessarily team focused. There are ones for team performance that can be potentially adapted, but we really need to move towards explicitly introducing a language around social congruence with students and communication, so that they have a framework to essentially carry forward and more opportunities in simulation to practice these skills.
Right. I think we've got a few polls which we might launch, and just to get some thinking going, after which we'll have a quick chat and head into our breakout rooms. So hopefully you'll all be able to see some poll questions.
Louisa, there's an interesting question in the chat asking if this final year was the first time that some of the students had actually done a sim, and they were just wanting to clarify if they had understood that correctly.
It is the first time. They'd all done lots of sims, but it was the first time the students did an interprofessional sim, yes.
Thank you.
I think it's fair to say that it's instituted at different degrees and at different universities, and some universities may have a lot of interprofessional sim, but equally there are only many universities where it doesn't really occur. And therefore, the person, let me have a quick look. Dale, we would love to hear Dale's experiences, because Dale sounds quite experienced in terms of interprofessional sim. It looks like there's a big spread, actually, which is, that's great to see. Lots of different ideas of pairings. And the medical nursing pairing does seem to be the most popular. And there are lots of reasons as to why that might be, which, doesn't necessarily need to be explained with this particular audience. But I think the idea of this poll, and also, in terms of coming up with breakout rooms, is to push us all to think about maybe this is what we would usually do, but what could we do? And can we extend what we potentially do, and other different ideas that we could have? So if we move on to the next slide, that introduces the breakout room. Yeah, so what we would love to hear in the breakout room is for each of the small groups to just share your experiences or ideas. So if you're thinking, actually, we don't really have that many of these experiences, but what we'd like to consider is, or indeed if you already have them at your university, to share what you currently do. In the sharing, perhaps you could think about the sorts of learning outcomes. And I know there was a question earlier from Bianca about, what are these learning outcomes that you would use for psychological safety? It's a fantastic question. And perhaps, some of it may actually come out in the discussion that we have afterwards. So think about the concepts of social congruence. Of course, psychological safety is one of those. And what sorts of scenarios? Morgan mentioned discharge summaries. I have other colleagues who run a fall scenario where, it's a natural sort of interprofessional scenario. So what other scenarios do you currently use, or could you think about using? So does anyone have any questions about these? In which case, please
Louisa,
join the breakout rooms.
Fabulous. Maybe you could just give in a nutshell, comment about the social congruence, just to reinforce for those that haven't heard that used very often.
Yeah, so the idea of social congruence, it was mainly used in the education literature around mentoring, peer mentoring in particular. But in this case, we've actually used the same concept to ground the idea of enhancing interprofessional simulation in terms of the non-technical skills. So what we had earlier in terms of the 5 aspects of the social congruence comes from a paper called Loiter et al. And we can share the reference as well so that you can actually have a look at it. And what they were talking about is, this is a great concept to ground the idea of teaching these non-technical skills, but what are the actual aspects that we kind of need to focus on? So they've actually broken it down into these areas. So this concept doesn't originally come from us, but we are using this concept because we think it's very helpful to apply this concept. So there are sort of 5 main areas. There's role understanding, there's the idea of psychological safety, there's the idea of forming supportive and trusting relationships, there's the idea of the environment, so a non-judgmental environment, and the idea of empathy and interest. So when we're setting our learning objectives, for example, or setting our learning and teaching activities, how do we consider some or all of these aspects when we're trying to target the non-technical skills?
Oh, fabulous. Thank you. So in a moment, you're invited to join a breakout room to discuss the questions placed into the chat. You will have either a guest, an AIPPEN steering committee member, or an ANZIPPE fellow in the room so that you have a rich discussion. Please briefly introduce yourself with stating your name so that we pronounce it correctly. Say where you work or your interest experience with IPE before discussing the question in the statement. When we return, we will have a whole group plenary where our guests will further elaborate some of the concepts that may have come out during the room and answer some questions that remain. So please keep your camera on. We won't be recording it in the breakout room. We look forward to seeing you back shortly. Welcome back, everyone. We certainly had rich discussions in our room, and I'm looking forward to hearing from our guest presenters what happened in their rooms. Please invite you to feel free to add comments into the chat as well as listening, and I'll pass you over to Louisa, Niki and Morgan.
Okay. I would love to hear some thoughts. I know we don't have too much time, but hopefully all the discussions were rich in the breakout rooms. But we'd love to hear some thoughts. Either unmute and share them with us, or perhaps put them in the chat.
Bronwyn, would you like to share some of the discussion from our room about the psychological safety that you talked about?
Yeah, we were speaking about, it was interesting in the pilot that you presented that it was a 60-minute duration simulation. And we allocate 2 hours for our interprofessional simulations to give lots of time to an icebreaker activity, an extended pre-brief, an orientation to the simulation environment, because our students are not familiar with the nursing simulation environment. And it was interesting. I would do my head in to try and get all of that done in 60 minutes with a debrief. And then I guess we leave 15 minutes at the end to conduct some evaluation to convince executives that this is a good thing to keep doing. And we talked about how we bake cookies and give chocolates to increase our evaluation completion rates.
A great idea. Niki, did you have any comments about the 60 minutes?
Well, the actual simulation itself was 60 minutes. The debriefing and the focus groups were outside of that time, and there was pre-briefing and orientation to the space. So the actual simulation time was 60 minutes, but it was extended beyond that. So one group essentially happened across the morning, and then the second group happened across the afternoon. In the pilot study, they spent much more time there, but the actual simulation was 60 minutes. And yeah, we had a few incentives to draw them there as well. Cookies and chocolates always helps.
Cookies and chocolate just help life.
So true.
Absolutely.
It may also be helpful that they were final year students, so they'd already been exposed to lots of interdisciplinary settings during their placement. Whereas I think perhaps if we had more junior students, we may need to have orientated them a little bit more.
We've also got one of the comments in the chat asking about the focus on medical and nursing, but also about the setting being hospital-based.
Yeah, that's interesting. We had some discussion in our breakout room about other spaces or other avenues other than the deteriorating patient in a hospital setting, and one of the ones presented was a palliative care scenario in paramedicine where the patient didn't necessarily need to go to the hospital, and it was in the home care setting. And how do you communicate and collaborate across multiple disciplines in order to ensure that that person has the best possible care for them, which I thought was really interesting and would potentially have some amazing learning outcomes. And I also highlighted something that we do in the Collaborative Practice Center here between nursing and physio, which could take place in a rehab situation. It could take place in a hospital environment where a patient's had a fall and they need to communicate and discuss firstly the logistics of how to get the patient back to bed, and then a handover, and then how to then talk to everyone from an acute to a rehab to a community-based setting to ensure that that patient doesn't have any further falls and to ensure they have the best care moving forward.
And there's some comments from room 4 where they also talked about situations beyond the acute deteriorating patient scenario, and suggesting that the non-acute situation might help the students familiarise and become familiar with each other. I wonder if you have...
So a bit more of a stepped approach. I think in our scoping review, we certainly found that it took at least 3 sessions really before the students were familiar enough to take it, further steps. So repeated sessions is important where possible. Sometimes there's resource constraints, of course.
Fabulous. So Niki, Louisa and Morgan, I wonder if there were any other insights that you had that you wanted to share from your rooms before we close out today's session?
Yeah, it was really, the discussion was really varied in our rooms, actually. We also talked about some mental health scenarios where, it's a nice scenario where we can bring lots of different disciplines together. One of the participants in our room talked about actually having a very large number of possible participants across all different year levels in a regional setting. That's very impressive. I wonder if are they still here? I'm not sure if they're still here.
I noticed that there's actually a lot of other people publishing about many of their work, which is fantastic.
Natalie, she's actually put her stuff there. Yeah, so yeah, which is great. I think it just all gives us various different ideas when we're trying to develop, what we would like to do on site. Yeah.
So on behalf of Megan and myself, I'd like to extend a very warm thank you to Louisa, Niki and Morgan for joining us today. Of course, an extremely big thank you to Kendall, who supports us seamlessly and expertly behind the scenes, ensuring that the event is run smoothly and all of the tech works beautifully. So thank you very much. And also to our breakout room facilitators, to our guests, our AIPPEN steering committee members and our ANZIPPE fellows, and to all of our participants who bring your enthusiasm, your insights and dedication to interprofessional learning to this community of practice. We've got a couple of things that I'd like to share. One is it's not too late for you to book in and come to Christchurch at the end of June, early July for the annual conference. And certainly an opportunity to meet together. There will be an event where people from AIPPEN will have a lunchtime activity. Also like to highlight that there's another ANZIPPE online session about making sense of complexity, an introduction to realist research in health professions education on the 18th of June. And a comment from Morgan saying that Louisa and he will be at ANZIPPE conference if anyone would like to catch up in person. Our upcoming AIPPEN event, our final one for the year, will be on 7th of October with Philippa Friary presenting at that. So welcome and look forward to seeing more of you again at our next event. Also like to highlight Focus on Health Professional Education, where our guest presenters today have recently published their research. It is an open access journal and it's hitting an audience that are really interested in these kind of practical but also evidence-based approaches to teaching in our setting. So really encourage you to consider publishing your work in this journal. We do value your contributions. There is a link which I will just also share into the chat. The purpose of these events is to encourage conversations between people interested in IPE, to exchange ideas, share practice. We want to know if we hit the mark or not, what we can do to improve your experience next time, and what topics you're interested in. So please fill out the form, and you'll also be sent a copy after our activity. So thank you all very much for coming today, and we look forward to seeing you next time.